Let's talk about the differences between internal edema and external lymphedema. External lymphedema in head and neck radiation or post-radiation is swelling around the outside of the neck. We can visibly see it as lymphedema therapists and as certified lymphedema therapists. We can see that our patients may have a little waddle, they may have extra fluid, there may be fullness or puffiness. That's going to be external edema. We can palpate it, we can touch it, we can feel and describe what's happening to our patients. Sometimes that external edema or lymphedema moves into the jawline. It's treated differently than that of internal edema. Internal edema, we are beginning to learn how to help our patients, but we cannot assess internal edema without a nasoendoscopy or a modified barium swallow study, preferably a nasoendoscopy. A nasoendoscopy, also known as a fiber endoscopic swallowing evaluation or a stroboscopy evaluation, allows us as speech pathologists to place a camera into the nose. The camera is placed into the nose, and we take a look at the inside of the patient's pharynx and larynx. We look at all of the structures, and we utilize the revised Patterson scale to be able to help us assess what are normal sites and what are edematous sites. So there is a difference from a clinical standpoint for external lymphedema versus internal pharyngo, laryngo, larynx, pharynx, edema. Each of those are assessed differently, evaluated differently. Treatment-wise, we are learning about internal edema. Treatment from external lymphedema, gold standard is complete decongestive therapy. So, see your local certified lymphedema therapist to be able to learn what routes should we be helping you to send the fluid off the neck into the remainder of the lymphatics so that your body can drain. We don't want that fluid sitting there. External lymphedema, while it doesn't hurt, it can collect fluid, it can harden and become fibrotic. Fibrosis later leads to difficulty with muscular movement. All things we don't want. So, work with your certified lymphedema therapist and continue to learn about what your body is doing.